Hello everyone, I'm Mickey Meehan, the Chief Customer Officer at MedPricer. I'm joined today by Jon Ellsworth, Director of Strategic Sourcing at Banner Health, and we're going to talk a little bit about supply chain and purchase services. Jon, it'd be great, just to get a little bit about your background. You've been kind of a few different places throughout your career, and it'd be great to just kind of hear how you got to Banner and how you've grown up in healthcare supply chain.
Yeah, definitely growing up still. So I've been with Banner for about a year right now. So prior to Banner, worked for Premier, who's a big GPO. Then before Premier, actually I worked for MedAssets. So MedAssets probably started with them about 9 years ago. So that's kind of when MedAssets was starting to kind of understand that PPI is big, purchase services is maybe kind of the wave of the future. So I was super lucky to join a great team at MedAssets, learn a whole bunch of stuff, travel a whole bunch, and really start to learn purchase services.
That's great. That's great. With all that great experience, what factors externally do you see affecting healthcare supply chain today?
Innovation. I mean, there is a lot of new vendors on the market who are continually coming to Banner, coming to everyone else with new ideas. I mean, I just met a gal outside who said she could save me 30, 40, 50%. I mean, there's just so much innovation going on, whether it's on the supply side, the commodity side, or even on the purchase services side. There's so much opportunity out there. It's pretty amazing.
And with Banner's reputation as one of the leading healthcare providers in the country, how does leadership and your team help bring that innovation inside and spread it around the organization?
So we try our best to be a facilitator. So when a supplier comes to us, either direct or through a surgeon or through the GPO, we like to understand what the impact might be, clinically, financially, operational. And then from there, if it makes sense for us, then we try and be facilitators and really cheerleaders to help make this work within the culture and the constraints of Banner.
That's great. Now, when it comes to your role specifically at Banner, can you tell us a little bit about your team and what you're trying to accomplish?
Yeah, so the sourcing team actually has 10 individuals. So we manage everything, I guess, minus labor and minus construction and capital. We kind of play in those roles, but it's really not our day-to-day. And so really my team manages everything almost on a 36-month or 3-year contract renewal calendar. And so when something actually comes up for renewal in 90 days or 180 days, depending on the category, we grab the data, start to understand who's in the market, how competitive is our current pricing, are there any new GPO options, any new people who are entering the market. So my team then actually works with a team of nurses. So if it's a clinical opportunity, we'll actually pull in the nurses to say, I'm thinking about going from vendor A to vendor B. Nurses, are these clinically equivalent, yes or no? And if it is, then we pull the facilities, facility leadership. So really, our job is to kind of manage the contracts, manage the categories, and really understand where there's opportunity to drive impact back to Banner's bottom line.
That's awesome. And so in terms of how that fits into Banner's future and goals, how does supply chain help drive those goals and that big future along?
Yeah, so Banner within supply chain right now, really our goal is to help Banner be prepared for the future. So reimbursements going down, for whatever reason, the suppliers are making more money, their margins going up, and our prices are going up in a lot of areas. And so we have to do everything that we can to squeeze the vendors as hard as we can. So that's really our goal, is to help prepare Banner for the future, to reduce those costs, to make sure that we're able to keep our doors open.
Great. Jon, so in your experience across healthcare organizations, do you feel that supply chain sourcing expertise is fairly represented, especially with high volumes of requests coming in from your stakeholders or end users?
I do. I look at the Banner team and kind of some of the past, or I guess pre-Banner experience on the consulting side. We kind of have two approaches. We either have an SME who really knows PPI, really knows all the products, or else has a generalist. So a generalist, in my mind, is good on their feet, good with Excel, good to ask questions. And so we have a really good mix right now at Banner between kind of the SMEs and the generalists, which I think helps us have a lot of good conversations and good dialogue with the stakeholders. But it's tough to find a good mix of team.
Absolutely. So, in your role as Director of Strategic Sourcing, what grabs your attention? What do you have your team focused on right now? What are those kind of big, high impact things?
Right now for us, it's what can drive us $500,000 or $1 million in opportunity. And so we have vendors come to us on a frequent basis. So we're working with one right now. So Phoenix has the majority of our hospitals. And so within Phoenix, we have a lot of capital. Capital budgets don't go very far. And so we actually had a supplier come to us and say, what would happen if you had to share capital? What if you had to move capital? So it's a very, very different way of thinking. At the same time, they started to layer in with our biomed conversation. What happens if you actually knew utilization for all of your tables, your surgical tables? So we never thought of it that way. And so when they came to us, the numbers started to make sense, the stakeholders started to get on board. And so that's just one of several initiatives that we're working on right now.
It kind of sounds like the Uberization of healthcare equipment there, moving around all over the place.
It's a very simple idea, but to actually put it into place is pretty difficult. But for us, again, it's what's new, what's innovative, and what can really drive a lot of value, especially considering our size. And also when you look at the market, we're so tight in the Phoenix Metro, it just makes sense. If we were more geographically spread out, it wouldn't make sense for us. With our market dynamics and just everything we have going on, it really is just a good fit for Banner. So we're trying to throw the time and the resources to see if we can make it healthy Banner.
And then getting back to something that you and I have talked a lot about in the past, small vendors with incredible technology like the organization you're mentioning. What's the thing that's holding them back from getting in front of healthcare organizations that you can tell? Is it just access because the signal to noise ratio is too high, or what's preventing them from being more popular with providers across the country?
It's a tough question. So we go to our GPO by default, and our GPO brings us a ton of opportunity. I look at these small vendors, they don't know what a GPO is. They don't know how to access a GPO. You look at Banner as a huge organization or a big ship. The only ship bigger than us is maybe the GPO and then like the United States government. I mean, it's tough to turn these big ships. It's tough to get access to them. And so I really don't know. It's a struggle, and something that, we've talked about that stresses me out is what's out there that I don't know about that could really change how Banner does business. And so I love to talk to people and learn what's working well and not working well. That's really the only way that we have to find these cool, innovative little players out there who can truly change Banner.
That's great. And at MedPricer, I think that's something that we're starting to focus on as well. We know a little bit about that, being a smaller supplier and obviously, starting to grow. And so we want to help make sure that we can bring, organizations such as Banner Health opportunities to not only save money, but to potentially improve care, improve efficiency, all those different things, as we move forward. I mean, that brings up another good point. I mean, given all these great ideas and looking to other industries for ideas of how to maybe do things differently in healthcare, what are the biggest barriers to an organization like Banner adopting it? Is it just straight knowing about it, like we just mentioned, or are there other factors that can make it difficult to move forward quickly?
So I think the knowledge about what's in the market is always tough. I mean, there's never enough time to learn what's available, because there's always someone small, someone innovative, someone truly changing the market on the East Coast and unstuck on the West Coast. I think the biggest thing for us when I think about it is we have a team of 10. And so a team of 10 at 2,000 hours per year, that's only 20,000 hours. We have a limited amount of time or resources that we can work. But then again, we have this mountain of opportunity. We probably spend $500 million, $700 million in purchase services. So how do we take all that spend and run it through such a small team? It's impossible. And so I think that's probably one of the major constraints of us right now is just the time and the resources that we can throw at it.
That lends itself to another good question. As organizations look at how they tackle that problem, there's third-party consultants, there's software, there's GPOs. What do you see the role of those traditional, third-party consultants and GPOs becoming as you move forward and as healthcare in general moves forward in the next few years?
So what we're trying to do is I've got the team of 10. And so what we want to do is we want to put the GPO almost in front of the team as well as MedPricer. It's kind of where you fall for us. And so when a vendor comes to me with an opportunity, if it's clinical, it kind of goes to the GPO. And if it's non-clinical, it kind of hits MedPricer. And so really we use third parties like yourself to kind of weed through the opportunities. So if you go through the process and say, hey, John, the spend is large, but we're only going to save $10,000. And you report back to me, I'm going to say $10,000 to disrupt 30 hospitals and a whole bunch of clinics, just really not worth your time. But if you come back and say, when you look at the benchmarks, you're way, 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 above everyone else, there's a $500,000 or $700,000 opportunity like you've done for me in the past, then I think we have to prioritize it. So for us, we try and put our partners in front of us to help us weed out some of the smaller opportunities. Now, when we have a clinical need or an operational need, kind of bypass the financials, but the majority of our work is financial driven. And so we try and use people to really weed out the work that actually hits to my team, because we do have a limited amount of time we can actually devote.
That's great. Bringing up purchase services now, it's an area that's still relatively young in how health systems are managing that part of their spend. In your opinion, what are the forces that are driving that push up the priority list of purchase services?
Yeah, so when I joined MedAssets 9 years ago, PPI was where all the money was from a consulting standpoint. And PPI started probably in the late 80s. Everyone today understands that PPI is a huge opportunity. We have all sorts of third-party benchmarking opportunities that tell us how our pricing looks when it comes to PPI. PPI is starting to burn out. It's now a utilization, or it's now a market share shift conversation, which is going to really be disruptive to the providers. And so in my mind, as PPI starts to curve down, purchase services is really filling the void within the hospitals of where to go and drive value. So really, I see purchase services just becoming more and more and more important in the future as PPI has less of a yield or return on investment.
And so when you start looking at purchase services, obviously, purchase services is inherently different given the fact of the service levels involved. How does that affect the way you look at that spend in the different categories? Does that factor in as you go to make priority decisions on the different categories you're going to source?
Yeah, so, and right or wrong, I don't know. I try and treat purchase services and PPI really the same. And so for me, what I was taught and trained is if I can make it a commodity, then we can make a change. So when you have a PPI, an item, or you have a knee implant, or you have a pacer defibrillator, those are driven by a surgeon. But if we can show across and show that it's a commodity, then we can then make a change. So the same thing on the purchase services side. If I can go make something that's very, very complex into a widget, if I can make it into a rate, into an hour, into a service that I can then bid out, then I can actually make a compelling story to a stakeholder that this is a commodity, vendor A and vendor B are both the same, let's bid this book of business out.
You bring up another good point in stakeholder management when it comes to purchase services. Obviously, with PPI, you're dealing with physicians, and they're notoriously probably difficult. They're trained on certain instrumentation and implants and all those kinds of things. But how does stakeholder management in purchase services, work at Banner, and how have you had success bringing those end users, clinical or non-clinical, together to make good decisions?
It's really telling a story, and for good or for bad, what we're trying to do is take away a Ferrari from a lot of our stakeholders and make them happy with a Honda Civic. It doesn't work very well, but in the financial climate, that's what we have to do. And so that's obviously a tough sell. But when we have the conversation, we have to have the data and explain, here's what you're giving up, here's what you get in return, here's what we're doing for you. And so for my team, if we can really tell the story to the stakeholder, then I think we can actually help them drive change. If we struggle to have the data to tell the story, and it's just old price, new price, then they're going to get upset with us when we try and take away the luxuries they've had in the past. And so it's really a storytelling conversation for us to get support, get value.
Well, and you brought up another good point about data. And so I think, coming into Banner, you've brought now a level of sophistication related to purchase services and the sourcing process in general. If your peers were looking to start purchase services, for the first time, what tools, what data do they need? How do they really kick things off and start managing that category more effectively?
So that's the easy part. So going back to MedAssets again, so I was there 9 years ago, fresh out of grad school, knew nothing at all. So during orientation, asked you what a GPO was, didn't even know what a GPO was, even though I was working for a GPO. So I got my first consulting engagement. It was a big idea in probably 15 or 20 hospitals. And I had to save $1 million, which was a big number, still is a big number. And so I took the AP file all the way from a $20 million vendor down to $50,000. And every single vendor in there, I put it in Excel and I Googled who it was. It took a week. It burned a lot of time. But for me, as well as for anyone who's starting to begin down that road of purchase services, once you know your vendors, that's the majority of the battle. I mean, even at Banner, we struggle to understand, because we're so big, which vendors play in which categories, and then which vendors play in multiple categories. And so just knowing which vendors are out there gives you a ton of knowledge to, again, go and have that conversation and really understand what's actually going on within your health system.
Absolutely, and I think the next logical step after getting that foundational understanding with the data is now maybe looking at benchmarking. And you mentioned benchmarking a little bit earlier. How does benchmarking fit into your purchase service process at Banner Health?
Again, it's really on the front side. So if there's any kind of a benchmark or a ratio or trends, so you've helped us identify a lot of trends, so which vendors or categories are trending up. Once we have those data points, it helps us understand, is this something that we want to invest time, invest resources, because we just don't have a ton of both. And so benchmarking is huge for us, clinical and non-clinical right now, to really determine where we want to go and place our resources.
So John, for MedPricer, it's been great working with Banner Health. I think our relationship has been extremely collaborative. You've really helped us come up with some exciting ideas regarding insights into trending in data, like you mentioned, and now looking at pipeline performance management and how you can really make sure your work plan is going to help you hit your savings goals. Can you tell me a little bit about how you think about some of those ideas and how you come up with them, and maybe some other ideas you have for the future?
So when I look at hospitals, we kind of have two options. We have someone who can really, really innovate and do new things, which of course I would love to do. And then I think we have hospitals or sourcing teams who can walk and tackle very, very well. When I look at Banner, I don't really know where we fall on that spectrum. I know that we need to innovate. I know that we need to bring new vendors in, but I also think that we need to be able to execute very, very quickly. And so when I come to MedPricer with a need, especially on the pipeline piece, the pipeline helps me understand what work my team is doing today, helps me prioritize the work, helps me understand, in end of year 2019, how am I going to be doing in 2020? I mean, it doesn't do me a ton of value to start going through 2020 and then at Thanksgiving have a fire drill saying we're not going to meet budget, we're not going to save enough money. And so the pipeline tool that we're working on together really does help me look ahead. We talk about firefighting and fire prevention a lot at Banner, so it's definitely a fire prevention tool to help me understand kind of where we need to be in the future. I also look at it and try and figure out how we can do better at blocking and tackling. So within Banner, it's a simple process. We have an idea, we pull the data, we do an RFP, talk to stakeholders, and it goes to legal. I look at my team and there's variations between the team, which is totally fine, looking at the categories and their understanding. But it'd be nice for me to understand that on average, an RFP takes 3 months, 4 months, 5 months. Because if we can compress that time, if we can compress the sourcing process, then I can go from identified savings to implemented savings, and then I can realize savings and bottom line either quicker. And so for me, what I'm trying to figure out is how do we balance the kind of the innovation piece, which is kind of what I love, with the blocking and tackling piece, which is kind of where I need to be. Does that help at all?
No, absolutely. I think one thing that you brought up that comes from pipeline performance management as well is the ability to take that data and help benchmark across the whole industry in terms of how long things should take and the potential outcomes that come from the process. Can you talk a little bit about what you see as the potential for the data across the industry more broadly and even idea generation across healthcare systems?
Yeah, I think a big miss right now on the non-clinical side is what's everyone doing. I mean, if we go and look at the med surgeon PPI, looking at hips, looking at knees, looking at pacers, defibrillators, we're looking at bedpan, there's a long list of boring stuff that's going on, but it's important work. When you look at the purchase services side, everyone's doing such different stuff. And there's no standard playbook or work plan out there. And so my wish to learn from everyone else is, here's a Banner store. We're doing 20 things. I'm sure 1 or 2 are unique and we're innovative on. I would love to look at someone else's with or without their name and understand 1 or 2 things that they're doing that I've never thought of. I would love to understand from everyone else how many categories or how many contracts that contract administrator does on an annual basis. How much value one person could drive. I look at my team and there's a big spread in performance, but again, it goes back to the categories that they manage in the contracts. But when I look at purchase services, $2 million is kind of the number that I was trained on. Is that right? I don't know. I would love to know what everyone else is doing across the country, because 2 million might be low, it might be high. I just really don't know right now.
I think that's one of the things I think MedPricer is most excited about is the opportunity for that data to really enter the market and help organizations, especially some who are early on in the process, understand what good looks like. Because without it, it's hard to get justification for budget for more resources, especially when there's tons of money out there to go get. It's just a matter of prioritizing and hitting the entire list.
I think the interesting thing is, so if your organization is saving more per hour or saving more in general than mine is, and we're both the same size, It's a question of why. Are you looking at different opportunities than I am? Are you quicker than I am? Are you able to move market share and I'm not? And so for me, learning from you, if you're another healthcare organization, that's kind of what I would love to understand. I mean, look at Linen. Everyone knows cost per gestation day. But then the question is why? Why is your number lower or higher than my number? What's the culture and the behavior and the communication that changes it? That why is really what I want to know. So of course, selfishly, I can take and improve myself and my team to, of course, better Banner overall.
And so, the next step, obviously, after looking at something like that is, perhaps going a level deeper and then looking at utilization management or KPI tracking and tools to do that in the future. How do you guys think about that at Banner Health? And is that something that you see as being needed in purchase services in the future?
Yeah, I think the KPIs are huge. So what I've been trying to do is leave corporate and get up to the sites. And so the sites always ask a big corporate structure, what have you done from it lately? And I don't have a very good answer for them, unfortunately. And so if I had a tool to push to the facilities to say, Hospital X down the road, here's 50 things we're working on for you this month. That's something that they want to know. At the same time, if I can give them a roadmap of everything we're going to touch in 2020 and then in 2021, they then have the opportunity to raise their hand and select and say, you're looking at pest control next year? I really want to be involved, and here's why. You're going to look at security services, you're going to look at something else, call me, or here's an email, or just reach out to me. That's something that I haven't done a very good job, and I think that the stakeholders really do appreciate understanding what's coming down the pipe, which is pretty exciting, I think, for us to really pull them in, because once stakeholders get engaged, it really changes the conversation.
That's great. Well, I really appreciate all the insights today, John. This has been fantastic. We appreciate you joining us, and we look forward to a continued relationship with Banner Health.
Perfect. Thank you.
Thanks.